My name is Ignacio Nunez. I'm the COO of ScaleReady. ScaleReady is a G-Rex-centric CDMO in Houston, Texas. Our vision is to structurally reduce the cost of cell therapies by deploying standards and teaching people how to unlock the full potential of G-Rex. I've been 20 years in operations. I've been working for companies including Novartis, Johnson & Johnson, University of Pennsylvania. Since 2023, when we launched ScaleReady, I've been helping to shape the vision alongside with John Wilson, who is the CEO and founder of ScaleReady, to change the paradigms that we have not. So everything is a process. The way I see a process is really a chronology of things that have to happen. Now, in order to optimize that process, you need to understand all the process steps, and then you have to identify what makes sense and what doesn't. Now, if you use as an example G-Rex, G-Rex is a phenomenal technology to use a standard platform that you can optimize your processes around. Now, when you follow the G-Rex alongside all the process steps to manufacturing a cell therapy, NK cell, TILs, T cells, whatever, eventually you realize that there is a lot of waste associated to every one of the processes. By definition, 60 to 80% of every process is waste. So when you start identifying all that waste, you're able to optimize your process, simplify the amount of process steps, and the result is magical in terms of lead time, in terms of performance, in terms of throughput, in terms of cost, and all that is the translation between, having a very wasteful process that is very costly and taking a very long time to reach patient, or something that flows seamlessly in a very inexpensive manner and reach the patient in the right manner. Well, we recently have this process at ScaleReady in which we have one of our clients coming from a larger CDMO, and the process was very wasteful. And by, again, looking into process, apply continuous improvement and tweak it, we were able to manufacture around 500 billion cells out of one single donor in 20 days. If you think about it, is something that is unseen. I mean, we're really putting the whole industry, challenging the boundaries of the whole industry, manufacturing 500 billion cells in actually less than 20 days, and in a space that is pretty much a couple of incubators. So from a lead time, from a cost, from a footprint standpoint, eventually you have something that is really simple to replicate, right? So you have to identify your standard. Once you have that standard, you have to decide when the standard is good enough, and from there on you start replicating, copy-paste the standard, and then when you have a high throughput model as the one that we are implementing at ScaleReady. The first cell therapy that was approved by the FDA was back in last week of August 2017. It was from that approval that there was an enormous attention and funding coming into the industry. Everybody jumped into cell and gene therapy. So you have manufacturers, you have medical devices, you have pharma, you have consulting companies, hospitals, everybody. A lot of people start raising money in large proportion simply because they thought the return on investment was going to be really big. Now, fast forward, then COVID impacted us all. it was because of that, all of a sudden, all the funding went dry. But the truth of the matter is, in 2024, we were long overdue of what I call the first continuous improvement cycle, right? So every industry, medical devices, pharma, whatever, they have gone through multiple continuous improvement cycles in which the whole field recalibrate. Has happened with medical devices, with pharma, with food, with automotive, with televisions, whatever business you look into, you see that it's in the moment that the industry gets some sort of solid, that they start the continuous improvement cycles, and then it expands and reaches more people, and then the costs start going down. Now, well, people may see this as a challenge for cell and gene therapy. I believe I only see good in this continuous improvement cycle, because what is going to happen is going to recalibrate the whole industry. There will be some companies that will go down, but will go down for the right reasons, because they have not been able to manage their funds in the right manner. I do believe venture capital investors, stakeholders, have become a little more savvy around, well, what they can expect, and they are investing wisely. And they are asking the companies, well, before I give you the money, I need to understand how you're going to use the money in the right manner, right? So don't build a 100 million manufacturing facility for one patient a month. That doesn't make sense, right? And actually, when you compare, for example, Europe versus United States, investors are much more precise, right? Here, when you have a new technology, you will raise maybe 3-5 million, but in United States you will raise 30 to 50. The order of magnitude is totally different. But here you have to make much more with less. And I just see good in this recalibration, this paradigm shift in cell therapy, because all of a sudden we see the whole industry being challenged to optimize their cost structure. And eventually we have the patients who are going to be the one paying for all this. So I think it's really needed. And look, if you don't look under the hood, and you don't know your numbers, if you don't optimize your processes, you're not going to make it. The quality, when we are manufacturing cell therapy for very, very sick patients, I think goes without saying, right? It's really in our hearts. Now, quality is not to say quality system. Yeah. We have seen heavily under engineered quality systems that eventually defeat the very purpose why they were put together, which is to take these life-saving therapies fast to the patients. Now, there are many ways to control your quality in a way that becomes predictable and in control. Deploying standards is very critical. G-Rex, for example, is one of those standards that we mentioned before. The fact that you can close G-Rex minimize significantly the potential quality issues that you may have. Things like your in-process testing, your QC release testing, all the environmental quality controls, and a very thorough training for personnel and manufacturing operators. Eventually is a guarantee that when you put all that together, you have a very streamlined manufacturing process alongside with the highest standards in quality. Well, a couple of things, right? So one thing is process and is operations, right? Before we were talking about process and the ways that you can optimize your process by fine-tuning the way that you handle G-Rex, for example. Now, the cost of your operations as a whole is a different story, right? So when you look under the hood in any company, you're gonna have three major components. You're gonna have labor, you're gonna have material, and you're gonna have overhead. Now, if you have looked into your process and you have optimized your process, that pretty much takes care of your material. But then you have labor, and then you have overhead. So labor is the way that you dimension your your teams in the right manner based on what your needs are going to be or are in the moment, because if you don't customize your organization to what your real needs are, what you are doing is adding up your cost. Eventually it becomes very, very risky, because every decision, every cost is cumulative, and then it's impacting your burn rate, and eventually could be a cost to go down for a company. Right now, I've seen in the cell therapy industry very heavy leadership teams. You may want to ask, well, how many C-suite individuals do you need to bring your technology towards an IND decision, a successful submission? And the answer will be, well, not that many. But I've seen companies with 5 to 10 C-suite individuals that are extremely expensive and eventually make your costs prohibitive. So we talk about material, we talk about labor. What about overhead? Well, overhead, in the same manner, you have to build your manufacturing capabilities according to what your potential throughput is going to be. So if you build a 100 million manufacturing facility for one patient every 2 months, well, maybe that's not the right size of a manufacturing facility, and those $100 million will kill you, right? So you have to look under the hood, you have to understand your numbers, you have to customize your organization, your overhead, your manufacturing capabilities, internal or external, because the same concept could be applied to a CDMO. And then you have to look also into your organization. And when you put everything together, is really the difference between an organization that is healthy, a company that is healthy, that knows numbers, that knows exactly what is the burn rate and how much money they have still available, and then an organization that is just overspending and they may not reach the next milestone in which they can raise money, which is very wasteful if you think about it. I remember talking about this a couple of weeks ago in another summit, and we're talking about waste. And to me, the biggest waste of all is that you have a life-saving technology, life-saving science, and does not reach the patient for the wrong reasons. That is really, it's heartbreaking. But I want to believe, to my point before, that there is a paradigm shift, there is a recalibration of the industry. Cell therapy companies are going to be much more cost mindful. So when you start with your science in a lab, very small scale, under the hood, and then you start thinking, well, what if I reach IND? What if I go to phase 1? What about phase 2, phase 3, commercial? I was in a panel before, we were talking about that, and some of the panelists were saying, well, what if you start thinking about automation at the very beginning? But then I was thinking, well, what if you don't have to really think of the scale up at all? What if you're using already something that is self-scalable, like G-Rex, right? So G-Rex, you can start in a very small scale, you could go to the 10, you could go to the 100 or the 500 seamlessly without the need of any tech transfer or anything like that, right? So by leveraging the power of G-Rex and unlocking the potential of G-Rex, you could start at really tiny, small scale in the lab, and then it can take you seamlessly to the G-Rex 500, which is the largest, which is the one that you would use for high throughput in a phase 3 clinical or commercial setting. So actually, you may be able to simplify, optimize, reduce lead time, reduce significantly the cost by jumping into G-Rex technology from the very beginning. And then as you continue growing, what you have to look into, not so much focusing on changing the G-Rex because it's one-to-one scalable, but looking into the ecosystem around the G-Rex. That's what we could change. And that's the opportunity, for example, for automation. One of the benefits of G-Rex, and we have seen that many partners are developing automation around the G-Rex. So you have started already with the G-Rex, you are there already, right? So use the G-Rex, scale up in the G-Rex, which there is no, I mean, we could even change the word, it's not a scale up anymore. It's just moving from smaller G-Rex device to the larger G-Rex device, and then optimize the ecosystem around G-Rex. And that is when I think you got a perfect flow between scientific discovery, R&D, preclinical, clinical, and commercial. And you stay exactly in the same platform, becoming super predictable. I believe automation. Automation is definitely the future. Whether full end-to-end automation or partial automation, or something before or after that, but definitely automation. But before that, I believe we have to seriously look to our processes and optimize our processes. So automation without a previous optimization is a recipe for failure. Now, I see multiple companies jumping into automation head on, thinking that, well, I got a lot of issues, so if I jump into automation, all those issues are going to be figured out. But guess what? They won't. What happens is that you will make all those issues automatic, and they will become part of your new standard, right? So I believe short term, the whole industry should streamline big time, learn how to improve process. We was coming from a panel discussion, and I was asking to the audience, well, how many of you know continuous improvement, lean manufacturing? Please raise your hand. And I think a good 60-70% knew lean manufacturing. Say, oh, that's very good. How many of you have you applied lean manufacturing in your current companies? 10%, probably less. That means that very few people are looking into processes, right? But I see a lot of people looking into automation, right? So I think that is a huge risk, because what is going to happen is it may very well happen that those companies jump into automation and doesn't work, and then it's too late, right? Mm-hmm. So first, continuous improvement, define standards, optimize those standards, and then once that you have somewhat sure that that standard deploys what you need in terms of lead time, in terms of efficiency, in terms of throughput, in terms of cost, then you make it automatic. I do believe that without somewhat automation, it's going to be complicated, the scale up, because the cell therapy industry right now is almost an artisanal process. 80 to 90% of all processes are manual. Mm-hmm. That means there is an operator under the hood doing something. Obviously, that gives you a big deal of flexibility. That's great, right? But when you're looking into thousands of patients, then your scale up is equivalent to also scale up your organization one-to-one, and that is not sustainable. But if you optimize your processes, it means that you require less operators, and eventually, potentially, you could remove operators, not totally, partially from your processes. Eventually, you will have something that is much more scalable and prepared for the future.